and welcome to my channel. I'm your host and tutor, Annalise Garrison. And today we're going to learn about acid-base balance in our bodies. And we're actually going to learn about respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. And in order to do that, we first have to understand that our body is made up of upwards of 60% water, ladies and gentlemen. 60% water. Of that, 94% is blood, 85% is lungs, 83% is kidneys and brain. This is fascinating. 95% of our eyes is made up of water. 75% of our heart is made up of water. And 75% of our muscles is made up of water. That is just fascinating to me. Absolutely fascinating to me. Therefore, acid-base balance is extremely important in our bodies. And in order to measure the acid and bases in our body, we do that through pH. So the first step in understanding our respiratory buffering system or our metabolic buffering system, because our body wants to keep everything neutral, our body wants to keep everything homeostatic, right, is to check the pH of the water in our body. Normal pH, as we can see from the graphic in front of us, the normal pH of water in blood is 7.35 to 7.45. If it's lower than 7.35, it is acidic. If it is higher than 7.45 mmHg, then it is alkalinic. So that's our first step in understanding the body's buffering system, okay? The other parts that we are involved in our body's buffering system is the lungs and the kidneys. So we understand the pH. Now let's talk about our lungs. Okay, the first thing we're going to talk about, let's talk about our respiratory system when it comes to acid-base balance, right? What does our respiratory system do? We breathe, and what do we breathe? We breathe in oxygen, right? Think about this. Our bodies, I've already ascertained that our bodies are upwards of 60% water. So pH is very important. Normal pH is 7.35 to 7.45. pH is very important. When it comes to breathing, we breathe in oxygen, we breathe out carbon dioxide. So carbon dioxide is very important. If the carbon dioxide is too high or too low, it'll throw off the pH in the blood, right? So if our oxygen is normal, if our carbon dioxide is within normal limits, then our pH will be within normal limits, and everything will be balanced. The problem arises, we get respiratory acidosis, we get respiratory alkalosis when the CO2, when the carbon dioxide is out of balance. So we measure the amount of carbon dioxide in our blood by the pCO2. The pCO2 measures the carbon dioxide within our arterial and venous blood vessels. It often serves as a marker of sufficient alveolar ventilation. That's very important to understand. If the CO2 levels are high, it indicates hypoventilation. If the CO2 levels are low, it indicates hyperventilation. So, what is respiratory acidosis? Now think about that. Before we go into the respiratory acidosis, what did I say? If the CO2 levels are high, it indicates hypoventilation, which means it lowers the pH. So what we have to remember for respiratory acidosis is simply this. Anytime you are not breathing off the CO2 in your lungs, you're keeping the carbon dioxide in your lungs if you are not breathing properly, right? If for whatever the reason, if you're having hypoxia for whatever the reason, you're going to build up CO2 in your lungs. When you build up CO2 in your lungs, you're going to lower the pH. What did I say about pH? Anything lower than 7.35 is acidic. Anything higher than 7.45 is alkalinic, right? So this is how we come up with respiratory acidosis. And as far as the patient is concerned, and as far as your NCLEX is concerned, or your HESI, or your ATI, or your next nursing exam is concerned, you want to think respiratory acidosis whenever the patient is not breathing sufficiently, whether it be hypoxia, whether it be rapid shallow respirations, a decrease in blood pressure, dyspnea. Think about that. Think about these things. Take your time with your question on your exam and simply think. If the patient is breathing too slow, we're going to have a buildup of carbon dioxide in the blood, which is going to lower the pH. And this is going to be respiratory acidosis. Now, anytime we have respiratory acidosis, the kidneys are going to compensate, and we're going to have metabolic alkalosis. But we'll talk about that in a minute. Right now, we're talking about respiratory acidosis. Okay, great. So far, we're all doing a good job here, okay? So let's go on to respiratory alkalosis. In like manner, if we breathe in too much oxygen, right, that lowers our carbon dioxide. If we lower our carbon dioxide in the blood, our pH will rise. When our carbon dioxide is low, why would our carbon dioxide in our lungs be low? Because we're hyperventilating, right? What causes hyperventilation? As nurses, as students taking our exams, as nurses taking our NCLEX, what causes hyperventilation? Think about those things. Anxiety, too much exercise, fear, being on a ventilator, all these things may cause hyperventilation, meaning that the CO2 in our lungs is too low. The oxygen is too high. The CO2 is too low, right? When the CO2 is low, the pH in our blood is high. When the pH in our blood is high and the PaCO2 is low, then we have respiratory alkalosis. Alkalosis, pH high. All right? So if you need to rewind and listen to this again, by all means, please do. So this is how our lungs balance our acid base. The respiratory regulation of the blood pH, the bottom line is this. The respiratory system can reduce the blood pH by removing CO2 from the blood. That's the bottom line. When you hypoventilate, you have respiratory acidosis. When you hyperventilate, you have respiratory alkalosis. Now, the only thing I didn't talk about is when the pH mixes with the CO2, it makes a chemical called carbonic acid. I didn't talk about carbonic acid because we don't look at carbonic acid when we talk about respiratory acidosis and alkalosis. We look at the CO2 levels and the pH. So just be aware that the lungs make carbonic acid. The reason I want you to be aware of carbonic acid in the lungs is just because we look at bicarbonate when we look at the metabolic regulatory system. Now, let's look at the metabolic regulatory system, which primarily is done by the kidneys. So when it comes to the metabolic regulation of blood pH in our bodies, this is mainly done by the kidneys. The bottom line is this: the kidneys can reduce blood pH by removing HCO3 from the blood. What is HCO3? It's an electrolyte. I'll tell you that in a second. So CO2 is a gas, HCO3 is an electrolyte. Fluid and electrolytes, right guys? Why? Why is that so important? Because our body is upwards 60-65% for men water, right? So keep it simple, kids. Keep it simple, stupid. That's what my teacher told me in college. I'm not sure if that was very nice, but I'll never forget it. So I'm telling you this. Kids, keep it simple, right? Fluid and electrolytes. Fluid, pH. Electrolytes, HCO3. Arterial blood gas, CO2. Right? All right, let's get started. What is bicarbonate? So one of the roles of the kidneys is to remove acid that is produced by the cells of our body and maintain a healthy fluid and electrolyte balance. And this is measured by looking at the bicarbonate in our body. Now, what is bicarbonate? Bicarbonate is a salt of carbonic acid containing the ion HCO3. So remember, carbonic acid was produced by the lungs. All right. Now, bicarbonate is a salt of carbonic acid. So what is the job of the kidneys? To remove the acid in our bodies. So when we think about the metabolic system regulating the acid-base balance, think acid, right? Think acid mostly. So metabolic acidosis has three main causes: an increase in acid production in our body and our blood, therefore, right? A loss of bicarbonate and a reduced ability of the kidneys to excrete excess acid. It's all about the acid, folks. All about the acid. Keep it simple, right? So this is why when we look at the kidneys and when we look at metabolic, we think bicarbonate, right? Because one of the main things is the loss of bicarbonate or the increase in bicarbonate. So that's why we look at the bicarbonate. Metabolic acidosis can lead to acidemia, which is defined as a pH of lower than 7.35. All right? Remember, higher than 7.45 is alkaline, but we're talking about metabolic acidosis. Acidemia is a pH lower than 7.35. So just to recap, the level of bicarbonate in the blood determines the severity of the acidosis. So normal levels is 22 to 29 milliequivalents per deciliter. That's normal range. Metabolic acidosis is 12 to 22 milliequivalents, and anything below 12 is severe acidosis. So let's stop for a moment and make sure that your notes are correct, ladies and gentlemen. Let's recap. Respiratory acidosis. If the pH is low, the PaCO2 is going to be high, and the bicarbonate is not measured with the respiratory. In respiratory alkalosis, if the pH is high, the PaCO2, your carbon dioxide, is low. With metabolic acidosis, if your pH is low, your bicarbonate is going to be low. All right? Because the job of the bicarbonate is to get rid of the acid. So, if your pH is low, your bicarbonate is going to be low. In like manner, with metabolic alkalosis, if your pH is high, your bicarbonate is going to be high. Let's talk about that. Now, look at this chart and make sure you have this in your notes. Now, everything I said about metabolic acidosis, the same is true of the opposite when we're talking about metabolic alkalosis, right? What is metabolic alkalosis? It's a condition that occurs when your blood becomes overly alkaline, too basic, right? So if your blood becomes too alkalinic, of course your pH is going to be high. You understand what I'm saying? So if your blood is too alkalinic, your pH is going to be high. What causes this? Remember I said the 3 causes of acidity. Well, the 2 main causes of alkalinity is too much alkali producing bicarbonate, too much bicarbonate in the blood, or too few acid producing ions. Think about that pH balance. You see? Keeping it simple, right? KISS. Keep it simple. Bottom line is this. This is the bottom line. If there's too much bicarbonate in the bloodstream, if the bicarbonate is high, your pH is going to be alkalinic. Your pH is going to be high, right? If the bicarbonate is high, the pH is high. Plain and simple. If the bicarbonate is low, your pH is going to be low. Bottom line. Right? Keep it simple. Right? So there you go, ladies and gentlemen. There's respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Now, in closing, let's look at some clinical examples of how this would manifest in the clinical. Okay? Anyone that gets tutoring from me, you know that I'm really big on critical thinking. I'm really big on teaching you something or tutoring you about something and then putting it all together. So I would highly recommend for anybody taking their ATI, their HESI, their NCLEX, or any nursing student, if you need help with taking an exam, please call me. Please contact me today. The least you could do right now is subscribe to this channel. So if you haven't done so already, please subscribe and hit that notification bell and hit all so that whenever I upload a video, you'll know about it. All right? Now, let's take each one of these separately and think about them in the clinical realm of everything, okay? Let's really think about this, and let's really put it all together. And let's look at signs and symptoms of these different metabolic acidosis, alkalosis, respiratory. Let's look at these signs and symptoms, and let's think, how would we, come to these signs and symptoms? Okay, nice and easy now, nice and slow now, okay? When we think about respiratory, you want to check the CO2 levels, carbon dioxide levels, right? Oxygen and carbon dioxide. Think about that. Oxygen and carbon dioxide. And so, what did I say about the respiratory when it comes to respiratory acidosis? Is it hypoventilation or hyperventilation? Hypoventilation, right? So anything that slows down your breathing, anything that clogs up the lungs, right? Probably with COVID-19, we're going to have respiratory acidosis, right? Because people have a hard time breathing. They get pneumonia. They can't catch their breath, right? So respiratory acidosis with COVID-19, for example. Um, so the causes are, anything that slows down your respiratory system, right? Um, Anesthesia, for example, will slow down the respiratory system. Anything that slows down the CNS is going to slow down your respiratory system. Slowed respiratory system, respiratory acidosis. Drug overdose, right? That slows down your CNS, right? COPD, pneumonia, atelectasis, right? All these things cause hypoventilation. Hypoventilation, respiratory acidosis. So, what is respiratory acidosis? In the lungs, an increase of CO2, because if we have an increase of CO2, we're going to have a decrease of oxygen, right? Remember I taught you that just a few minutes ago? Sure. So we have an increase in CO2, therefore we have a decrease in pH. Acidosis, right? What are some other symptoms of acidosis? Drowsiness, dizziness, disorientation, muscle weakness, hypo. You see? Hypo. Think hypo. Hypoxia. Hy- hypo. 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 Blood pressure. Right? Low blood pressure. Dyspnea. Headache. Hypokalemia. Dysrhythmias. Alright? So anything that slows down your respirations, and think about decreasing blood pressure, right? And think about like slow healing wounds. Wounds need oxygen to heal, right? Well, if you have carbon dioxide, your wounds aren't going to heal. You see, just think critically about these things, okay? For those of you who are getting tutored, I will tutor you more about the causes and signs and symptoms and how to manage that. And instructors, I would suggest that you stop the video here and talk more about clinical manifestations, clinical presentations of respiratory acidosis. What would cause that? Remember that respiratory alkalosis is hyperventilation. What would cause hyperventilation? Anxiety, overexertion, fear, mechanical ventilation, I think would be another one. So think about that. You get tensed up, right? Seizures, hyperventilation, I already said that. Tachycardia, your heart's racing because for anxiety or whatever. Nausea, vomiting, anything that would cause things to speed up. What happens when you get anxious? You throw up, right? Nausea and vomit. Just think. Take a minute to think about these things. Numbness and tingling in the extremities, right? Because your CNS is overactive, right? So, overactivity, hyperventilation, hyper, right? The only thing that would be hypo is hypokalemia. With respiratory acidosis, we would have hyperkalemia. You might want to write that down, okay? Respiratory acidosis, hyperkalemia. Respiratory alkalosis, hypokalemia. Um, Again, I'll talk more about this when I tutor you, and your instructors will talk more about this now. Okay, when we think about the respiratory system, I want you to look at CO2, right? Carbon dioxide levels. When we think about the metabolic system, I want you to think about the bicarbonate. So, respiratory acidosis. It is the job of the bicarbonate to get rid of the acid, right? If we remember what I said, if we have low HCO3, we're going to have low pH, right? Think about some of the causes of that. A decrease in HCO3 production, okay? A decrease in elimination, right? If we have a decrease in the elimination of HCO3, bicarbonate, if we have a decrease in the bicarbonate elimination, what is that a sign of? Renal failure, right? Think low blood pressure. Think hyperkalemia. All right. Think warm, flushed skin. Think a decrease in the muscle tone, a decrease in the reflexes. This sounds a lot like respiratory acidosis, doesn't it? Same symptoms, huh? You see what I'm saying? So, just critically think about these. Just slow your mind down and think. And like I said, I'll help you when I'm tutoring. Okay? Let's look. The last thing. Let's look at metabolic alkalosis just for a minute, okay? Because I know this is getting long. Metabolic alkalosis. Remember, if there's an increase in the HCO3, there's going to be an increase in the pH. Remember what I said with the respiratory acidosis? If you have respiratory acidosis, you're going to have metabolic alkalosis. Well, here it is. Now, what are some of the things that might cause an increase in the pH as well as an increase in the bicarbonate? NG suctioning. I was thinking about that. Maybe suctioning will do it. Dysrhythmias, specifically tachycardias. Confusion. We're going to have confusion. We're going to have nausea and vomiting. We're going to have diarrhea. We're going to have an increase in anxiety, seizures. We will discuss more of this when I tutor you. So let's stop it here, all right? Because we've been going on for a while. Let's stop it here. I will do more of this in our tutoring session should you need further assistance. Let me leave you with a list I want you to write down. Take a moment to write this down. Respiratory acidosis, respiratory alkalosis. Here's the list. Go ahead and write it down. Metabolic acidosis, metabolic alkalosis. Go ahead and write it down. And thank you for coming to this session. And I'm glad you enjoyed this class. For those of you who I'm tutoring, I'll talk more critical thinking skills in our tutoring session. And to the instructors that requested that I help you, thank you for requesting my assistance. Authors of books may also use this. Just please give proper credit. Here's my credit. And I will see you in the next video.